Vitamin B6 plays a pivotal role in maintaining healthy nerve function, yet its involvement in neuropathy is one of the most overlooked aspects of nutritional neurology. While peripheral neuropathy, a condition characterized by tingling, numbness, burning sensations, and pain in the extremities, is often attributed to diabetes, alcoholism, or a lack of vitamin B12, B6 deficiency, and paradoxically, in rare cases, B6 excess, can also be a root cause. Unfortunately, B6 status is rarely measured during neurological assessments, leading to frequent misdiagnosis and prolonged suffering that could otherwise be resolved with simple nutritional intervention. The active coenzyme form of B6, pyridoxal 5' phosphate (PLP), is essential for the synthesis of neurotransmitters, including GABA, serotonin, and dopamine, all of which regulate not only mood and cognition but also the excitability of peripheral nerves. B6 is also required for the metabolism of sphingolipids, key structural components of the myelin sheath that insulates nerves and allows for proper signal conduction. In the absence of adequate B6, nerve cell communication becomes erratic or diminished, leading to sensations of numbness, pins and needles, and in more advanced cases, severe neuropathic pain or weakness. Symptoms of B6 deficiency-induced neuropathy can closely mimic those seen in diabetic neuropathy or B12 deficiency. This overlap contributes to diagnostic confusion, especially in patients with borderline lab results or multiple underlying risk factors. For instance, a diabetic patient with neuropathic symptoms might be prescribed stronger glycemic control medications or even painkillers without anyone checking their B6 levels. Similarly, a patient with fatigue and nerve tingling might be tested for B12 and folate, but not B6, leading to missed opportunities for more targeted and less invasive treatment. The populations most vulnerable to B6 deficiency-induced neuropathy are broader than many clinicians assume. Chronic alcohol users, the elderly, individuals on certain medications like isoniazid, hydralazine, penicillamine, or birth control pills, and people with malabsorptive conditions such as celiac disease or Crohn's are all at increased risk. Pregnant women who experience elevated nutrient demands and vegans who consume limited amounts of B6-rich foods may also be susceptible. Even individuals under chronic psychological stress, which accelerates B6 metabolism, can become deficient despite a seemingly adequate diet. The consequences of this oversight can be frustrating and debilitating. Many individuals with B6-related neuropathy are placed on long courses of nerve pain medications such as gabapentin or pregabalin, which may provide partial relief, but do not address the underlying nutritional problem. Others undergo extensive diagnostic workups, MRIs, and referrals to neurologists, when a simple blood test and thoughtful clinical history could have pinpointed the issue earlier. In a more preventive context, B6 repletion could even slow or prevent the progression of neuropathy in at-risk individuals, especially diabetics, where oxidative stress and poor microcirculation already strain nerve health. Adding to the complexity is the dual nature of B6. Both deficiency and excessive intake can cause neuropathy. While extremely high doses, typically over 500 milligrams per day for extended periods, of supplemental B6 have been linked to sensory neuropathy, these cases are rare and usually reversible upon stopping the supplement. Unfortunately, this potential for toxicity has made some clinicians hesitant to recommend B6 at all, contributing to a wider problem of undertreatment. In reality, doses under 100 milligrams per day are considered safe for most individuals, especially when guided by symptoms and lab results. Because of these diagnostic blind spots, a large number of people live with preventable nerve symptoms, burning, numbness, poor coordination, that could be resolved or improved with better B6 status. The symptoms may seem minor at first, perhaps dismissed as poor circulation or just getting older, but over time they can progress to functional impairment and increased fall risk, especially in older adults. In summary, vitamin B6 deficiency is a largely unrecognized but significant contributor to peripheral neuropathy. It masquerades as more well-known conditions, escapes routine testing, and leaves many patients trapped in a cycle of misdiagnosis and ineffective treatments. By restoring B6 to its proper place in neurological evaluations, especially in those with unexplained tingling or nerve pain, clinicians could offer a low-cost, low-risk solution that addresses the root cause rather than just managing the symptoms. Far from being just another B vitamin, B6 is a gatekeeper for nervous system integrity, and its absence speaks loudly, if only we listen.